We have a standalone Nurses' Day on a Sunday, and it's separate from the main body of EBMT. And this session is effectively a day in a bag. And what we try and do is a variety of talks around a central theme. And this then can be taken by other centres, and they can look at this selection of talks and maybe have their own speakers within their own countries would be able to put this together and try and do this as a standalone session later on in the year. So this year we were looking very much around consent and how patients think about having a transplant and what brings them to the point of agreeing to have such a complicated process performed, and something that is potentially going to limit their life if they're one of the unfortunate people that don't make it through the transplant process. So we were very fortunate that we had a psychologist, Dr. Alex King, who works in London, who looked at how a patient processes the information that they're given at the point of consent and says, okay, this patient is coming through for a very complicated procedure that ultimately might kill them. How do they understand what you've said to them, and how do they consent to that, and how do they take that on board and then move forward with it? At the same time, he explained the theory behind that, but then had a patient who'd been through this process and said to him, well, this is how we think it happens. How did you process that information? What did you do? How did you cope with that? And they had a nice interaction of play between each other. There was 5 or 6 questions of how he understood what was going to happen, how he processed that, how he got through his transplant, what his values were, what his expectations were, and what his family's expectations were, because he was a young man. He was only 19 or 20 when he had his transplant. At the time, he was living outside of the family home but moved back. So there's all the difficulties for him being an independent adult, then moving back into the family home, and how that dynamic changes once you've left home, moving back, that protective umbrella that your family then put over you, and you have that expectation of, am I doing this for myself, or am I doing this for my family, because this is what they expect of me? And it was interesting to see from his perspective, who was he doing this for? Did he think, well, I have to do this because my mother and father expect me to have a transplant, to go for a life-saving treatment, but I don't want to do it because I'm scared or frightened? Or is it, I know I can get through this because I have the self-belief that I can get through it, and it doesn't matter what everybody else thinks? So it was an interesting dynamic of asking that question of somebody, because you don't often get to do that in the clinic situation. It's, well, you have this disease, we're explaining it to you, are you happy to go ahead with it? We don't often explore it much further than that because time limitations within a clinic. It's just not possible to do.